This program contains content that may not be suitable for viewers under the age of 18. Viewer discretion is advised.
Ruzungu kade kazuku tujikole sawa namba ruzungu.
Ruzungu tugenda muza kujjere kutoka ntoko ndimbuzi ndi hapo ala bora babaddi abakyala
wale somoyo mbenye mbuto katonda ya chembuto genda weji waminge
yabaweereza buno bukeke obutini
singa babu mutwale bamusonseka mukamwa bwonna n'abufulumiza mu nnyindo
kibwa ina guno omuggo gwa Musa white premium detergent
waliwo wanagambye munda yakasajja kasendi kalimba banaye esendi banaye. So welcome to yet another edition of Kasuku Live. Talk to the doctor. We come in here from TMR Hospital, Nadia, a TMR Golden Living specialized clinic. Yes. Wetuva. To talk about different things. What we do basically is we touch the surface. Yeah. Then when you want to know more, you have the situation. Your general information, you can always come by TMR here and you ask the doctor. Yes. So I'm joined by Mr. Elado. He's a gynecologist here. You're welcome to the show.
Thank you.
How are you doing?
I'm okay. How are you?
I'm okay. How is life?
Life is good.
You have the beard.
You also have?
Yeah, I do. But yours is, and I think I'm going to like I chopped my hair and people said, yeah, but people told me it's now okay, you remove the hair so that there's nothing here.
The bald, you leave the beard.
Yeah, so things work out. So you're a gynecologist?
I am a gynecologist, but also I'm into fertility issues or people who are trying to conceive.
Yeah, so I have a friend of mine, he calls the gynecologists pussy doctors.
Okay.
Is it a bit strong?
It is. I think we don't just focus on the genitals.
Hey, gynecologists do more than that. I thought like you just look at you're like, okay, let me see.
There is more to gynecology than just only the genitals. Okay, because remember, from the time a woman gets into reproductive age, she undergoes changes. The changes could be to do with the hormones. The changes could be to do with the pregnancy itself. Until they transition into menopause, all those are changes that actually women may require.
So like a gynecologist can. Okay, in my mind, I'm like, okay, the theory I have is the only time a woman needs a gynecologist is when they are pregnant. Is that true?
Not necessarily. Because you see, you can actually need a gynecologist, for example, for women, if they're having issues of infections.
Okay.
All right. So if they're having issues to do with the hormone imbalance, right, they're not seeing their periods and all that. Oh. Yes. If they're having issues of cancers, you see, we have cancers that affect women, like cancer of the cervix, cancers of the ovaries, cancers of the uterus. You get. Wow. Yeah. So it's just not restricted to the pregnancy. Yeah. But also there are so many branches of medicine that we just have to get a branch that focuses on the changes and issues to do with reproduction.
So the gynecologist only deals with women?
Not entirely. We also handle male issues. All right?
A gynecologist.
Yes.
So
Although,
there are females that are gynecologists.
Absolutely. There
Oh.
are females who are gynecologists, there are males who are gynecologists. But also for male issues, especially to do with the erectile functioning and all that, the urologists also come on board to help.
Oh, okay. And today we are here to talk about male infertility. Yes. So what is happening there?
A lot. I can honestly, fertility has changed over time. In the past, we would mostly accuse the women
Over being infertile.
So if a couple is having challenges trying to conceive, the number one, the eyes would focus on the woman.
The woman.
Why are you not getting pregnant? What is the problem? And I will interest you by letting you know that over half of the couples who fail to conceive are because of the men.
What? 50%.
50%, about 40 to 50% of couples who fail to conceive, men are responsible. Okay, so it is a very big. It's no longer something you just look into the woman. And many times when women come, they fail to conceive. You do all the necessary checkups. Got it fine. Everything is okay. And then the husband comes, and we find issues.
So what are some of these erectile dysfunctions we are having?
So, for fertility, we don't just zero it down on erectile dysfunction, because you see, someone can have sex for 1 minute
and you get pregnant.
Exactly. So it's more than just the penetration. Okay. So when we're looking at fertility in men, we are looking at the most important aspect of fertility, which is the sperms or the semen.
Oh.
You're getting it?
Yes.
So it's the semen that is very, very important in men. And it's one of the things that when a couple comes in, they're failing to conceive, for women, we will check and see if their ovaries are producing the eggs. We will check if the tubes are open. We check if the uterus is fine. Now, for the men, we just want to know if he has the semen that is being produced is good or has issues that need to be addressed. So for men, we one of the commonest tests that we get to ask is sperm analysis or semen analysis. Can you give us the sample? And then we check and see how really the sperms are. Then we can be able to determine from there.
So what are the common causes of male infertility?
So for
today,
as of date, it's actually interesting that for over the last 40 years, there has been a decline in male fertility. In fact, studies are showing that almost the sperm quality or the sperm count is almost reducing to half as of 40 years ago and today. So that shows that there's a trend that is alarming that men need to be able to look out for. Men produce sperms. Each ejaculation that a man has produces over 400 million sperms.
Wow.
Okay? So, of course, in a common person's mind, you want one sperm. But any man who produces less than 40 million sperms has a hard time making a woman pregnant. Can you imagine? Okay? Now, for us outside there, people think, I just need one sperm.
Like this.
And yet, for us here, we are saying your sperm count should be above 40 million.
40 million.
Why? Because the act of helping a woman to get pregnant is not a very simple feat. And it's interesting, of course, those who don't put in the effort just get pregnant. But then you find the couples who are struggling and men who are struggling. Because once the sperms have been produced, those sperms take over 3 months to mature. Number 2, after they have matured, those sperms must be deposited into the vagina. The vagina is a very hostile place. It is acidic. That's why the sperm is produced with other juices that neutralize the acidity of the vagina. And then number 3, those sperms must swim all the way up to the fallopian tube to meet the egg. When they meet the egg is not a simple structure. It has a very thick wall around it that it requires a group of sperms to help break it down so that the lucky sperm, the you and me's, can successfully enter. So if you look at it from that point, it is not a very straightforward process. But of course, out there,
omusajja obona knowing and not knowing. Kati sperm olira process gyeyitamu. Kati let us imagine now this situation. Olabye omuwala omukwanye akulidde omwegayiridde yeeyambule akugyemu kale ate nekyofulumya nakyo nekirwana olutalo lwakyo okuguka.
The vagina is so hostile that it destroys some, it actually traps some sperms. Even the cervix can arrest some sperms and tells them you're not going anywhere. So that's why you need a lot of them to overcome
40 million of them.
You need over 40 million.
Zigenda zirwana.
Others die on the way until the given percentage reaches where the egg is. Then they start now breaking it down until the lucky sperm gets through.
Karate obeera lucky sperm mazo yitamu. Ate omuyaye n'akugyamu era n'agasaagala kufuna lubuto.
So yeah, so those are the struggles that really are there for the men. So to answer your question, what is really happening? Why are we seeing the decline?
What causes? Yes.
Why are we seeing this difficulty? One is that we're having a shift in what we call environmental factors. We are exposing ourselves more to radiations, okay, as compared to how it was before, right? In the olden days, we never used to have phones. We keep them around our pockets and all that. We go through machines that having radiations and all that. We're also exposing ourselves to things like plastics. All these are things that can actually affect the hormonal structure of the man and eventually affect the quality. So we term those ones to be environmental factors. Then the second cause is to do with lifestyle and health factors. For example, if you look at the trends of obesity, they've changed. In the olden days, our parents, maybe the food was scarce or they had so much struggles, but the trend of obesity is really going higher currently compared to how it was. And obesity can affect on the sperm quantity and sperm quality. We are also seeing things like infections. We are getting more
infections.
With our generation, or people have started sexual intercourse very early compared to how it was back then in the day, where people would wait, and then if they do get engaged, they end up with marriage and all that. Ours is different. And so we are more prone to sexually transmitted infections, the likes of HIV, the gonorrheas, the chlamydias, and all that. So these infections are also more in time than they used to be in those times. Then we are seeing things like intake of alcohol. Alcohol intake and smoking. These ones directly destroy the DNA. These are sperms. So it means that you can have a sperm there and the DNA is abnormal. Now, let me shock you, Kasuku. If that sperm enters the egg and it is abnormal, the egg will reject that sperm.
Hey.
Yes. So the egg has got an internal process that can determine that this sperm is not going to give us the yield we want. So if you expose yourself to illicit drugs, the marijuanas, the shishas, the cocaines, and the cigarettes and all that, that is going to affect the quality of sperms that you're actually going to produce, and their DNA is going to be destroyed. Then naturally, we claim women have a biological clock. Close are women by 30, they should have children by 35 and what? By 40.
You should have had children.
Because the quality of the sperms by 40 starts reducing. Sperm count reduces. Sperm quality reduces. The sperm starts swimming slowly beyond 40, 45 years of age compared to someone who is younger. And yet we are seeing many people are delaying to have children.
These days.
Yeah,
that's true.
because life is really difficult. So someone wants to first have a job, be a manager or something, have his mansion, or others are pursuing the career. So the same happens for men as well. That they're taking that delay and they think that by the time I'm 40, I can now have children. But by that time, a lot has changed in your structure. But also, we see other risk factors. For example, careers. There are occupations that just put us at risk.
Yeah.
Drivers, for example. If you're a driver, whether you're a long distance driver, whether you are a delivery driver or rider, okay, you're at risk because the longer you sit, whether it's in your car seat, there's a lot of heat that is building up around the testes. The reason why these balls hang out is so that the factory is having the right temperature
to work.
to work. So if you are sitting for long, that means you're going to build up a lot of heat. You're bringing the balls next to the body, so they're going to have the body temperature. And secondly, if you are exposing yourself to vibrations, for example, ovuga pitchy, you're going through humps all the time and all that, that constant shaking and all that of the testicles is going to definitely affect the factory from functioning well. We have seen men who are so much into sauna, steam bath.
But sauna is bad, but steam isn't.
But you see, anything that is going to expose you to higher temperatures, you get it. So that also puts you at risk. And reduces the quality of the sperms. There are men who are working in fabrication, metal fabrications and welding. That is heat. Men who are working in bakeries, all right, and chefs, and you're exposing yourself to heat and all that. That is putting you at risk. So we are having even professions themselves, professions that have a lot of stress.
Stress,
financial stress, whether you're a financial manager, whether you are a health worker, any job that gives you stress. The stress chemical directly affects the brain, and the brain will not produce hormones for sperm production. So you can see there's quite a number of risk factors that actually are making the trend of male infertility to actually worsen.
So, what are some of the remedies for male infertility?
So, first is that my advice usually to couples is that you need to fight the stigma, okay? Because the earlier we find the problem, the better. Most times when couples are trying to conceive, the attention is on the woman. All right, and women are very health seeking. For her, she will find out what is her problem. Nasirika. She will suggest it. Jangu, let's go to hospital. If you don't go, she will keep quiet. She will know, I don't have any problems.
Actually,
So unless you also come and we do a test, we can't be able to determine that.
So people should do routine tests.
Yes. So we especially for people who are taking long to conceive, if you've been with someone for more than 6 to 12 months, you've been having regular intercourse, she's not using any contraception, tafunyo rubuto, please just come for a checkup. And that checkup helps us to know, is there something we can do about your situation? All right? So that is one. Number 2, of course, is treatment, especially in terms of these infections. Don't take long to treat them, because the longer you take,
the more it will hurt.
And some of these infections can equally affect the where the sperms pass. They can equally cause blockage of those tubes where the sperms are going to pass. And then that is going to make things worse. All right. Then, of course, we encourage people to have a bit of change, be more active, exercise. All right. When you do this exercise, it builds up your testosterone levels, which increases the sperm production. All right. The weight loss itself is very important. The alcohol reduction in alcohol and use of some of these drugs is very, very helpful. If anything, currently there's a trend of, you've heard of egg freezing. Egg freezing is now with us. Where women say, I'm not ready to have children, let me keep my eggs.
Yeah.
Okay? So they go and keep the eggs. So in first world countries, they also have trends of sperm freezing. You get it? You know that if I'm going to be focused on my career, let me go and freeze my sperms. When I'm ready, they can use the sperms for IVF and all that.
We've had the talk of cashew nuts to improve sperm production. Is that true?
So the diet is very important. I know, of course, there's a talk about groundnuts, cashew nuts, in improving on sperm quality. And I just want to be generic that there's a degree. They contain the necessary proteins that are required. But most times we emphasize a general balanced diet. Have greens in your diet. Have fruits, because the greens and fruits help reduce the stress, what we call antioxidants. And stress is worse in terms of destroying the sperms than anything else.
I see.
And also, of course, reducing on the processed foods, the cheap pussy, because of all those things.
Yeah.
If you can reduce, especially for people who are trying to conceive, if you are at the phase where you want to help your wife get pregnant or to get a pregnancy, that would be safer for you to then stop the alcohol, all right, and distance yourself from the cigarettes and all the substances. Because when you do that, and ideally for about 3 months, because the sperms you have now were formed 3 months ago.
I know.
So whatever you did 3 months ago will depict on the quality of the sperms you have now. So when you have an intention to conceive, you might as well just do something about your health for like 3 or 4 months until maybe the pregnancy
is there. It's quite the conversation we have had. We've not really had a discussion about male fertility.
Yeah.
And most men naddala abalaba temwagala nnyo kwogera ku nsonga zino. Yensonga lwaki dokita agambye nti mwesiba nnyo ku bakazi.
Yes.
Era abasajja bangi olubagamba nti kati tugende naawe bakukebere tebaagala kukola ki. Yeah, but sometimes some of these conditions are reversible. Nga bagambye solutions jangu weekebere wano mpola mpola otandika kizimba. I know a friend of mine yali aina sukaali pressure kati nga badde kwera eddagala lya sukaali naye basawo ne bamugamba no tukitwala mpola mpola, just maintain your weight, do the same things but on this particular medication, eat these foods, and now aina abaana babiri, you know. So kyamuyamba namanya nti now I need to look after my body, my health and what, but now mweyafunira n'abaki n'abaana. So people should not just write you off for manyi kati insulini amalawo kino. No, it is a myth.
It is a myth, and we just advise, especially for the men out there. Of course, there are other, like the underlying pressure, sukari, okay? Those are some conditions that can affect, for example, your stamina, your ability to erect and all. And sometimes that reduces on your confidence. If you can't have an erection, then there's no way you can have the sperms being released to get it. So it's very important that if you've noticed that I've been with my partner for 6 months, we have been having regular sex, and regular means at least 3 times a week. One guy, sometimes I get couples. Someone has been away in Dubai. They come for 1 month, then the woman doesn't get pregnant, and then they are getting worried. Oh, you've not had regular sex. Have regular sex, minimum about 6 to 12 months, no pregnancy come. Then we are able to just discuss and see where is the problem. Can we fix it? And then we take on.
And of course, studies happen over a period of time. Absolutely. We cannot use 1 month as a sample space. No, you can't. At least you could say 3 or 6 or even a year to come, you know, to that conclusion. And it's nice having you and having this conversation. I hope the men you pick a lesson. You can always come to the doctor mpola mpola weka nojja nomugamba nakulabye oyogera ne Kasuku kati ndinamu ekizibu ekiti munkebere mutulabe, so that even the treatment ogitandikako omukyala takola ki kati abasinga kwe bavudde basiba abaana abatali baabwe because they don't, omukazi akunnyonnyola n'ogaana ate nga yeetaaga okuuma obufumbo. so n'amaliriza ng'akoze eki ni wano jangu bakakutema enti amajigo tegakola kati bw'oba osobola oyambe watosobola otunuulira ebyana ebyo ogambe si byange otandika okunywa bbiyawo nga baana babanja fees ogitegedde wabi
It's not bad, but
so guys, especially the men, we need to embrace fertility.
yes,
These are conversations now we need to have.
yeah,
We need to begin having. We need to embrace doing these tests at TMR hospital here. Ogenda kusanga Dr. Elado. Oyogere naye abikuyise man to man abasawo teboogera byama by'abantu ekintu kisobola okubeera nga kikoze eki. But you have a wife?
yes.
Okay, like you're married in church?
Kasuku, why are you on me?
Auntie, you know, when you said gynecologist,
Yes.
I'm just wondering how many have you seen? Like, do you still think, wow, this is okay? Like,
No, but Kasuku, when we are treating patients, to be honest, at that point in time, you just want to help someone get better. You're not thinking about.
Right. So you don't think about the sex.
You don't,
So you don't look like at a patient and like, fantastic.
Kasuku, no.
Or randomly, if you're seated here, then the patient walks by and you're like, she's got a nice one. It doesn't come to your mind.
No, it does.
Yours is special.
Business. This is business. Okay. So you are trying to make sure that, yes, of course, you're making people fit.
Yeah.
But also, there's a lot. There's your reputation. People will not, if you are that type, people won't trust you.
I know.
People will be like, Ogenzo wani? You get it. So you want to be able to, and you see, it's a very delicate career, and I think for most doctors out there, they know that you should be a very level-headed person to be able to do that.
So I have a few questions I want to ask you, especially those that pertain shape and size, so that I can give to Mr. Haina. And he can tell the world the different stories. But yeah, it's nice. It's nice meeting you and having this conversation with you. And I hope we are going to meet again.
Sure, for sure.
You know, and you can put in the comment section some of those issues you have, so that we can begin forwarding them to the doctors, and we have a discussion. And
they're just afraid to go to hospital.
Exactly. I've encountered so many people who go to hospital, even with fertility issues, and they tell them just begin jogging, lose weight. And
the next thing?
All you have to do is to lose 3 kgs, and others probably maybe that telling kugwe nga it's chiri wano chiri mbwongo, you need to how you romance and those things, and those are the challenges. So it's not like every time you hear about male infertility or sperm count and what, it's very complex. Always see the quality of sex you're having is not good.
The number of times of the
thank you temwega sekimala nebisigadde kale tweyanza nnyo sebo. We hope to see you again.
We will.
Kale until next time mubeere bulungi mweraba.
The views expressed on Kasuku Live do not reflect those of the hosts, producers, or management. They are solely of individuals providing them and do not represent or reflect the official policy or position of this YouTube channel.
Luzungu kade Kasuku tujikole sawa namba Luzungu.
Luzungu tugenda
musale kujere kutoka ntoko ndimbuzi nekuno
ana bora babaddi abakyala
wale somuyomba inyembuto katonda ya chembuto genda wedi waminge
yabaweereza buno bukeeke obutini
singa babu mutwale bamusonseka mukamwa bwonna n'abufulumiza mu nnyindo.
Kibwa alina guno omuggo gwa Musa wayitista premium detergent.
waliwo wanagambye ebola y'akasajja kasendi kalimba bannange.
Yeah.